my name is Courtney Colvin, and this is the video recording for the abdominal assessment. This is my volunteer Dawn, and I have explained to her the procedure and what we're going to be doing today. So first I'll begin with preparation, what I would do with a patient as I uh, prepare to assess them. First I will make sure that when I walk into the room, I wash my hands and introduce myself. Hello, Dawn. My name is Courtney. I'm a nurse, and today I'm going to be assessing your abdomen. So at times I will have to touch you with my hands and my fingers, and I'll also be using my stethoscope to listen to things such as bowel sounds and etc.
Okay.
To make Dawn most comfortable, what we've done is given her a sport top to wear and covered as much of her as possible in order to do the exam thoroughly and accurately. So we just used a little blanket here. And we have Dawn sitting in the supine position in a private room. And she has a pillow under her head here. And she has a small pillow under her knees. And this is to allow the best position to assess her abdomen. The temperature in the room is comfortable. We know part of Dawn's skin is exposed, so we don't want her to be cold because that can make some of her muscles in her abdomen tense up and cause some, maybe some negative readings. So we want things to be as accurate as possible. She has her arms down by her side, and they're just under her blanket here. And we are ready to begin. So Dawn emptied her bladder before the beginning of this procedure, and because we told her we would be pressing, and sometimes if you have a full bladder, that can make you feel like you have to go. So at the beginning of an abdominal assessment, I first start with observing. So her position for her position for breathing is comfortable and relaxed. I see no distress, and her skin color is normal for her race. I don't see any large lesions or moles or anything like that, and her skin color is the same throughout her whole body. Her stomach is slightly uh, paler in comparison with like her arms or chest area, which get more sun. So her facial expression is relaxed, and her level of consciousness, she's alert, oriented, and cooperative. During the exam, I tell patients if it makes them more comfortable, they can close their eyes, or they can make eye contact with me as I explain what I'm doing during the assessment. So I will go ahead, and at this time, we'll go ahead and begin to start not only observing but inspecting Dawn. So as I inspect her, I first am going to look at her contour. So whenever I'm doing this, I can stand up at Dawn and look down, and then also I can kind of stoop to become kind of even with her abdomen here. And there are many different kinds of contour which reflects nutritional state of a patient, and hers is flat. She doesn't have a large bulging uh, abdomen, uh, and her contour is flat, so that's good. That's what we would want to see. Anything else would maybe indicate some abnormality. No concave or scaphoid contour here. Also, her skin color and condition, again, I can take a further look into it. And so I'm just going to get a little closer to your abdomen, Dawn. And I do notice, and I'm noting from her history, that I see uh, 3 small markings here from a hysterectomy she had 23 years ago. So bilaterally here, she has the small scars and near her abdomen. And also when you're inspecting, oh, my screen went dark. There we go. We'll make sure you can see me. Um, when you're looking at the abdomen, you want to look for bilateral symmetry. So in this case, she has bilateral scarring, but her umbilicus is midline and inverted, and I don't see any redness, any sign of a bulging, a mass, or a hernia, no distension. Um, I'll try to warm up my hands. Um, and I'm just going to touch around your umbilical ring.
No discomfort.
Okay. Do you feel any pain or tenderness?
None whatsoever.
Okay. I don't feel any masses in this area. Um, so that's good. We would not want to feel those things. Um, so after we look at that, we want to make sure that as we're inspecting Dawn, that we make sure that she has we want to look for the presence and or maybe absence of any abdominal movements or pulsations. So in Dawn's case, I don't see any real pulsations, but I do see abdominal movements, but they're in conjunction with her respiration. So as I see her chest rise and fall slightly, I see her abdomen do the same thing. Also, to assess for masses, especially if you don't have a handy flashlight or your lighting in the room isn't as good as it is right now for me, you could also ask the patient, which Dawn, if you can do this, without using your hands to lift up your head, just lift up your head, okay, and back down. And as I was looking at her abdomen, besides her skin folds, which that's all normal when we do that, um, I did not see the presence of a bulging mass. You know, like if you saw a unilateral mass, then you would think, okay, I need to, you know, look further into that. You can just place your hands down back by your side. All right. And just remind your patient that you will be as thorough and not quick, but you will perform the procedure in a timely manner. And you want to make sure that you're going in a logical sequence. So I'm just trying to be as thorough as possible and hit all the high points of the exam. So we have thoroughly observed and inspected, and those are things that you do before you touch the patient. You want to go from the least invasive and so forth. So before I start touching Dawn, I want to ask her, are there any areas that you know of that are tender right now to you or
None
painful?
whatsoever.
Okay. If Dawn said yes, then I would make sure to assess that area last, as in pressing it, because that can cause pain for the patient and that would affect the rest of the exam. So we can start first with auscultating. And whenever we auscultate, we want to go in a counterclockwise motion. And so I'm going to start with auscultating at the right lower quadrant. And I'm dividing her abdomen in 4 sections. So the right lower, the left lower, left upper, and right upper. And when I listen and auscultate, I'm listening for vowel sounds to be present. So this is any kind of like click or gurgle, and they can sound irregular, but we want to listen for 1 full minute in each quadrant. If I hear a vowel sound, some people can go ahead and move to the next quadrant, but you want to make sure you hear a vowel sound in all the quadrants. So that's what we're going to do at this time. And I'm using the diaphragm of my stethoscope. Vowel sound. Vowel sound. Vowel sound. And vowel sound. And as far as the description of them, like I said, it's a gurgling click, and they are irregular. So they're normally on the higher pitched end uh, in sound description, but as far as how many you're going to hear a minute, the normal vowel sound range is anywhere from 5 to 35 vowel sounds in 1 minute. Hypoactive vowel sounds, which Dawn doesn't have. Oh, my screen went dark. Sorry. um, a description of hypoactive vowel sounds would be less than 5 in a minute. Hyperactive would be greater than 35 vowel sounds in a minute. And if you want to make the um, documentation that your patient has absent vowel sounds, you need to listen to the entire abdomen for at least 5 full minutes before you make that assumption, because that could indicate a possible mass or irregularity. So we've auscultated the vowel sounds, and at this time we can go ahead and we can auscultate with the bell of our stethoscope. And when we're auscultating with the bell, now what we're going to be listening to is the presence of any bruits. And when you're talking about bruits in reference to the abdomen, this can be any kind of hum, or this is basically, you don't want to hear this. So we'll listen to the umbilical area and the epigastric area, the aorta, and then the arteries. I can listen to the renal arteries and the iliac arteries and the femoral arteries. And at the time that you're listening to the iliac arteries, just so I don't have to do it more than once, you can go ahead and earlier in the inspection, most people would observe for hair distribution. And in this case, this is a adult female. So her pubic hair growth does occur near the pubic bone. So while I'm down there listening for the femoral artery, any bruits near those areas, I can assess for that. And we did that in privacy before this was on camera. And so after we have listened with the bell, we can go ahead and note that there are no venous hums or any kind of bruits, which would indicate that we need to look into that further. So that's good, Dawn, that we didn't hear those sounds. So now that we have auscultated, we can go ahead and we can percuss. And when we're percussing, once again, we want to use a dominant hand, and then with my dominant finger, I'm going to simply tap on my finger. And to percuss is to listen for certain sounds. There's tympany, and then there's dullness. Dullness can be heard over solid organs like the liver. It can be heard over a distended bladder. And when you're listening for things such as tympany, that can be heard over areas that contain gas or air, so like the intestines. So we can go ahead and start, and we go in a certain pattern. So for this, I'm going to kind of have to stand up so I can be over her. All right. Dawn's very sensitive to my cold hands. I can't get them warmer than what they are. Okay. I'm hearing the dullness over the liver.
Yes.
And I'm hearing some of the tympany, I can tell, over areas. Place your arm down by your side. All right. And sometimes you have to repeat that skill. Dawn did move. So if I felt like I couldn't hear, what I do is if they do move, I just kind of stop and I wait for them to remain calm again. And then I can repeat like that one area. But I did hear the dullness over like the liver You can hear it close to the spleen. Oh, my computer screen went dark. There we go. And then you can hear the tympani over the areas that contain gas or air. All right, so now that we've percussed, we can go ahead and we can palpate. And whenever you palpate the abdomen, you want to start with light palpation before you move on to deep palpation. So light palpation is where you only push in the abdomen up to like 1 centimeter. And so I just use one hand for this, and I've kind of not make a true C shape, but I just kind of curve my hand. And what I'm going to be doing, Dawn, and I make sure I have short fingernails because I don't want to jab my patient, is I'm going to go in kind of a circular motion. And when I move to the next area, I lift my fingertips and I move over. And I just kind of go in a circular pattern, and I ask them as I'm doing it if there's any pain or tenderness. So for this, I'm going to start on their left lower quadrant. Okay. Any tenderness there?
None whatsoever.
Any tenderness there?
No, ma'am.
Over the ascending colon? Any tenderness there?
No tenderness. None
Transverse,
there.
transverse colon?
No.
Okay. As we go to the ascending colon?
No.
Any tenderness there?
None.
And we get to the cecum?
No. No.
Okay. We are trying to see if we can assess for any masses, tenderness, bulging, and in this case, we did not feel any of that. So as we go into deep palpation, I'm going to make sure, sorry, my screen keeps going dark. I'm going to make sure that I use two hands for this. So what I'll do is with my non-dominant hand, I'm going to be using to actually palpate, and then I'll put my dominant hand over my non-dominant, and I'll use that to apply more pressure so I can go deeper. In this skill, some people go like 5 to 8 centimeters, depending on the size of the patient and how large their abdomen is, maybe how much subcutaneous, how much adipose tissue is between you and, an underlying organ. So to begin, I'm going to once again start over and go counterclockwise. And I'm going to start on the left lower quadrant. Breathe in and exhale. And I go all the way up to the costal margin. Any tenderness?
None. I can feel you doing this, but it is not uncomfortable whatsoever.
Okay. Making sure to lift my fingertips as I move. Okay. In this deep palpation, you can palpate for the organs. You can also detect for masses. So this is why this skill is used a lot, and it is really good at doing so. Sometimes if we are not sure a mass is present, when you kind of lift up to move, some patients can have such things such as rebound tenderness or extreme pain. So you need to look further into that if the patient's having that kind of acute response. So after we use light and deep palpation, some people choose to go a little further and palpate the main organs that are of key focus in the abdomen. So I'm on my patient's right side as I have been the whole procedure, and I'm going to go ahead and try to palpate her liver. And to do so, I will put my left hand underneath her 11th and 12th ribs. Go ahead and place your back all the way flat. And with my right hand on the costal margin, I can go ahead and kind of stand up with this. And I'll ask you to inhale and then exhale, and then kind of push your hands together and kind of go underneath. All right. And if you do feel the liver, it should feel firm. It should feel, the patient should feel no tenderness upon palpation.
None.
If that was hard to, if you weren't sure that you were feeling the liver, you could try a different technique. Where their costal margin is with both of your hands, kind of feel against that and inhale. And as you exhale, just kind of cup your fingers. And sometimes the liver kind of slides to your fingertips. You can feel it there. And it is a very smooth, um, solid surface. If you want to try to palpate the, I think my battery's going dead. My screen keeps going dark. If you want to try to palpate the spleen, which is on the left side, what I can do is, are you uncomfortable? You keep moving a lot.
I'm just moving, but I'm not uncomfortable.
All right. What I'm going to do is use my left hand and place underneath. All right, you can go ahead and relax. And that can be at the certain angle. And then I'm going to take my hand and place it at the costal margin. Breathe in, exhale, and push in and up, down. And sometimes this spleen is very hard to palpate. But same thing, the patient should not feel any tenderness or pain when you do that. And there are a couple ways that you can assess with palpation of the kidneys. And you do have two kidneys, so you can do this from either side, but once again, I do it from the right. And you can place your hand underneath, okay, and your other hand here. Breathe in and breathe out. Okay. And you can do the same thing on the other side to assess for symmetry. And I've done that, but I get out of the camera view. So now what we can do is ask the patient to go ahead and sit upright. And at this time, I'm going to go ahead and assess for any flank pain. If her kidneys are hurting her, whenever this is performed, she will definitely have a reaction. So I place my hand about the 11th or 12th rib and sit upright. And I'm just going to use my other hand to hit the hand that is touching you. And if you feel anything, let me know. Besides a thud, was that painful?
No.
Do the same thing on the other side. Nothing?
Nothing.
Okay. And once again, if the patient had any kind of kidney enlargement, or if there was something going on, an abnormality, that would probably hurt, or you wouldn't receive the same response from Dawn, who has basically normal function. Nothing is abnormal. From the assessment of Dawn's abdomen, I perceive that she doesn't have any enlargement of organs. There were no bruits when I listened to her abdomen. She revealed that she didn't feel any pain. She didn't feel any tenderness. And so overall, I think Dawn is, as far as her abdomen goes, she is fairly healthy. So to continue on with further assessment, beforehand, to make them feel comfortable and to kind of get to know the patient, you can ask them about daily bowel patterns and habits and things like that, just to get comfortable to the patient, break the ice, and prepare them for what you will be doing, which I did with the physical assessment. So thank you. Hope you enjoyed this video.